here in Miami-Dade County, when the order was crafted by the Commissioner of Education, it reflected the counties that had already moved to Phase 2, which was every county in Florida except for Dade, Broward, and Palm Beach. As you know, Palm Beach is now Phase 2 county as well. And so we've been working very hard and closely with the mayor here in the county, and have been very, very pleased to see the direction that this has gone in the county in terms of COVID-19 over the last 4 to 6 weeks. Miami-Dade County has, in my judgment, the best large urban school district in the country. And a lot of that is because you have a lot of great folks working day in and day out, the teachers, the administrators. You also have great leadership with Superintendent Carvalho. And I was really excited to see when I came and we met earlier that he provided me really phenomenal AP exam results in Miami-Dade County, just really off the chart. I think the results are, if you would have said 10 years ago, people said there's no way you would have been able to do this. And so it's really, really encouraging what they did in terms of the passing grades for Hispanics. It's an increase of 24 percentage points over the last many years. Amongst African Americans, 3 or higher on AP has increased by 25 percentage points. Again, these are really, really strong numbers, and I don't think that they probably have a peer anywhere in the country in terms of those numbers. And so today, understanding how important it is for parents to be able to have that choice, understanding the great work that's been done in Miami-Dade County over the last decade under the superintendent's leadership, and then also other leaders like Mayor Gimenez. We really want to make this a reality for all 67 counties, including Dade and Broward counties. And so today, I'm announcing that effective Monday, both Broward and Miami-Dade County will be moved into Phase 2. And of course, the most significant aspect of that is it really clears the pathway for in-person instruction to resume, of course, at the parents' discretion, and we want to continue to offer parents the ability to do remote learning if that's what they want to do. This is really, really important. I mean, we've had a very difficult 6 months, but it's been very difficult for kids. They were taken out of class in March, going to remote learning. Many of them did a good job under the circumstances, but it's just not quite the same. Being able to be back in with those teachers, with those mentors that really help their development, I think is absolutely critical, and that will now soon be a reality. And if you look at what's happened here in Miami-Dade County, today the reported positive rate for diagnostic tests was 4.87%. This was in the 20s. In July, and so they've had huge decreases. COVID positive hospitalizations have decreased by nearly 75% since the July peak, and new admissions to the hospital for COVID are down 82% since the July peak. And those individuals going to the emergency room with COVID-like illness symptoms, that's decreased by more than 80% since the peak on July 7th. So Miami-Dade has gone so far in a good direction. Really appreciate that. And then Broward has done phenomenal as well. They're back at 3-4% in terms of their test positivity. Their hospitalizations are down by over 75% since the July peak. Their daily admissions to the hospital for COVID positive individuals is down 85% from the peak. And then those going to the ED with COVID-like illness has decreased by more than 80%. And so that's really strong progress. I think Palm Beach also demonstrated that, and when they requested to go into Phase 2, we were happy to do that. So we want to continue working together. I told both the mayor and the superintendent, we stand by ready to assist as you guys make this transition and provide parents with this really, really important choice to resume in-person schooling. I believe this is important for all 67 counties that parents have this, but I especially believe it's important here in Miami-Dade because I think, let's just be honest, it's a lot easier to run a school district, in a rural county than it is in a big urban area. And so I think as they go and they show them how it's done, I think that's going to be great for the state, but I also think it'll be a model for the country. And so I look forward to seeing that and working together. We appreciate all that Miami-Dade's been able to do in education. And we do have some private schools that have had in-person and some charter schools. I think the Catholic schools are waiting for the county, and I think a lot of the charter schools as well. So this will be important for the school district, but it's also going to be important for some of those other schools that have basically been wanting to move together for in-person instruction, and I think that's true for Broward as well. So Mayor, thanks for all your hard work. We're happy to turn it over to you.
Thank you, Governor. I really appreciate it. Thank you, Governor DeSantis, Lieutenant Governor Nunez, for sharing the good news and next steps about moving Florida and moving us to a phase 2 and getting our people back to work. Before I say a few words about the county's reopenings, I want to also stress that today is the anniversary of 9/11. I know that everybody who lived through that day carries a very heavy heart. However, those terrorist attacks also brought the best out of all of us. Our nation came together, showed the world our greatness as one nation under God. We came back stronger than ever. So today I'm optimistic that we're coming together here in Miami-Dade County to tamp down this pandemic that we have been facing since March. Very happy to say that thanks to our community doing their part in wearing masks and social distancing and practicing good hygiene, we're seeing great results. Today's positivity rate for Miami-Dade County is 6.3%. Hospitalizations continue to go down, so that gives our health workers, who have been heroes throughout this entire ordeal, a little bit of a break. And our elderly and those at high risk of the virus continue to be protected. I want to thank Governor DeSantis for his leadership and support to give Miami-Dade County the flexibility we need to get back to business. The state has been a great partner, and it's thanks to you, Governor. I really appreciate it. Now we're ready for more openings. So on Monday, my administration will be looking at what businesses we can reopen that were forced to close in June because of the spike after Memorial Day. Those includes entertainment venues like movie theaters, bowling alleys, playhouses, and arcades operating at 50% capacity under strict rules to keep people safe. Let me be clear that Miami-Dade County will not be opening up bars and nightclubs. There are other parts of our state where opening bars is perfectly okay, fine, because they have very few cases of COVID-19. We're still not out of the woods yet, but we're getting closer. We must make all sure that take personal responsibility about protecting ourselves and others from catching this virus. So next week, we will be opening more outdoor venues like the zoo, as I mentioned on Monday. For this second phase of indoor openings, I will continue consulting with our medical experts to make sure that openings are done the right way. And I want to give time to those entertainment venues that qualify for opening a limited capacity to get ready. I will also be working with Superintendent Carvalho, as we have been for several months, to help the school system open with a hybrid model. And again, Superintendent, I'm looking forward to working closely with you. I know it's your call and also the school board's call. We'll have more details next week about those phase 2 openings. For now, I'm very pleased that our community is taking this virus very seriously by wearing masks and keeping and maintaining social distancing. That will be key to our future success. By working together and continuing to follow safety precautions, we can move forward and get our businesses back up and more people working again and keep them working. And now I'll say a few words in Spanish. Buenas tardes. Gracias al gobernador DeSantis y vicegobernadora Núñez por compartir con buenas noticias y próximos pasos para seguir abriendo nuestras economías. Antes de decir unas palabras sobre las reaperturas del condado, quiero subrayar también que hoy es el aniversario del 11 de septiembre y todos llevamos un peso grande en nuestro corazón. Sin embargo, esos ataques terroristas también sacaron lo mejor de todos nosotros. Volvimos más fuerte que nunca. Así que hoy soy optimista que estamos unidos en nuestro condado para combatir esta pandemia. Gracias a nuestra comunidad practicando la distancia social, usando máscaras y lavándose las manos a menudo, estamos viendo grandes resultados. La tasa de positividad de hoy para Miami-Dade es solo un 6.3%. Nuestros hospitales siguen bajando y nuestros ancianos y aquellos con alto riesgo del virus siguen estando protegidos. Quiero agradecer al gobernador DeSantis por su liderazgo y apoyo para darnos la flexibilidad que necesitamos para seguir abriendo la economía. Así que el lunes mi administración estará mirando qué negocios podemos reabrir que nos tuvimos que obligados de cerrar en junio. Estos incluyen lugares de entretenimiento como cines, boleras o bowling alleys, teatros y arcadas que fueran a operar al 50% de su capacidad bajo regulaciones estrictas. Déjame aclarar que Miami-Dade no abrirá bares y clubs nocturnos. Todavía no estamos al momento para abrir bares. Así que la próxima semana vamos a abrir más lugares al aire libre como el zoológico que mencioné el lunes. Para esta segunda fase de aperturas consultaré con nuestros expertos médicos para abrir de la manera correcta y quiero darle tiempo a los lugares de entretenimiento para prepararse para abrir. También trabajaré con el superintendente Carvalho para ayudar al sistema escolar a abrir sus escuelas. Tendremos más detalles la próxima semana sobre estas aperturas de fase 2. Por ahora estoy muy contento de que nuestra comunidad se tome este virus en serio. Usando máscaras y practicando la distancia social será clave para nuestro éxito futuro. Trabajando juntos y siguiendo los protocolos podemos seguir adelante. Muchas gracias.
Great. Well, thanks, Mayor, and happy to recognize the Superintendent, Alberto Carvalho.
Thank you very much, Mr. Mayor, and welcome to Miami-Dade. I promise you this will forever be the best backdrop for a press conference you will ever experience, probably. Thank you very much for your visit and your leadership. We appreciate, number one, the flexibility that's been extended to our district in terms of federal through state investments that have protected the viability of our school system, have allowed us to enhance sanitization and the preparation of our schools for the return of our teachers and students at the appropriate time. With the transition of our county to phase 2, effective Monday, that lifts a huge roadblock that has prevented us from taking additional steps. But that's not everything. Much like the mayor said, we are both informed by some of the best medical minds, some of the best public health minds in the country, right here in our community. And I can tell you, Mr. Governor and Madam Lieutenant Governor, that our school board had approved the reopening plan in consultation with those experts, declaring 8 specific criteria that have been measured over time. And we are happy to report at this point that every single one of those data points declared in the gating criteria for the reopening is being met, putting us in a position of having simultaneously a declaration of phase 2 with additional reopenings in the county, side by side with every one of the gating criteria recommended by our experts coming together within the timeline that I believe will allow us to reopen schools within the initially declared timeline. We had told this community that by September 30th we would make an announcement. I think we'll be able to make an announcement about the date before that for that criteria is being met. Next week we're going into a special board meeting where these matters will be discussed. Next week we're also convening the medical experts to get a final recommendation and recognition of where the medical data stands today. So we are extremely encouraged by the downward trends that we have observed, and they are consistent with what the governor and the mayor declared. So lower positivity rate, lower than 10%, heading towards 5% and ultimately 3% over a 14-day period of time. Lower hospitalizations, lower use of ICU bedding, lower viral strength in the community. That's the total number of COVID positive cases. Increased testing, but also an increased frequency of testing, but also swifter results. All of those elements have moved in a very positive trajectory for our community, and combined with the declaration of phase 2, it opens the doors literally to the possibility of a return to schools. The last thing I will say is that we know, and we have known all along, that the schoolhouse is the best place for children to learn. We know that working parents, are facing challenges. And we recognize, and we've talked about that this week, that teachers have overcome incredible challenges, as have students, through their distance learning model here in Miami-Dade. So this is good news for everyone. Yes, there will continue to be choice in this choice district. And we have surveyed our parents, and parents will have a choice to continue to maintain distance learning, and now in this new platform that we have reinstated fully as of yesterday. But parents will also have the choice, based on the announcement next week, to return their children to school. And right now, our community has declared that about 51% of them want to do just that. We ought to satisfy that essential need for our community. Obviously, when they return, we will have in place all of the safety and precautionary measures in place, with increased sanitization cycles, with isolation rooms, with a nurse in every school, with appropriate social distancing. But I want to be clear, 6 feet of distance is probably not going to be possible in many schools. That's why the requirement of masks, self-assessment of students prior to leaving their homes, self-assessment of employees prior to leaving their homes, and declaration, so that the risk of contagion is significantly decreased. So, Mr. Mayor, Mr. Governor, Madam Vice Governor, welcome to Miami-Dade once again. And on behalf of the chair of the school board and the entire school board, our workforce, our teachers, parents, and students, we look forward to a schoolhouse reopening later on this month. Thank you.
No, thank you. I think it's really important. And you mentioned this has been a very difficult time for a lot of parents. You're asked to potentially have to be working to provide for your family, but also having to juggle hands-on, helping to educate your child in an in-home environment. It's very, very difficult. And particularly, I think, the burden falls especially heavy on our working class parents, our lower income parents. And so you hear stories about these affluent families doing pods and doing all this other stuff, but we got a lot of people that don't have that luxury. And so having the ability to opt for in-person education is going to be so important to so many families throughout Miami-Dade County. So I'm really excited. I know the county has really been thinking about this for a long time. I think they have a good plan in place, and I was, because we have the other counties are in. They started football season. People started. I went to a high school football game up in North Florida. They were asking me whether Miami was going to go in, because they know that the football state championship is likely to run through Miami-Dade County. I said, look, I think we're going to get them there. So I know you guys would like to have a cleaner path to a state championship. But when you have the city that has the most NFL players come from it at any city in the country, we know we got to get them playing again. So we're really excited about doing that. Michael.
If I could, before he takes, I'd like to make an announcement that the Combat COVID app is now available to be downloaded at the App Store, and also for the other devices. And this particular app, which is free to all Miami-Dade County residents, if you download it, all it will do is, if you have been in contact with somebody that has tested positive, will advise you that you have been in close contact with somebody who's tested positive and to go get tested. We urge everybody to please download this app. That will help us maintain a low positivity rate, as you can get notified much quicker that you've been in contact. There is no personal information that's interchanged. All you will know is that somebody that has meet the protocol, you've been in close contact for a certain amount of time with that individual at a certain distance, you should get tested. And so please, it's called Combat COVID, Miami-Dade County. It's free for Android and for Apple devices. So please download it. If you could all get that information out, we certainly appreciate it. That's also part of the reasons why we're able to open. Our contact tracing is much better, much more robust now than it was in the past. We are able to open up more and more businesses because we have these capabilities here in Miami-Dade County. Thank you, Governor.
Great. Michael.
Thank you, Governor. I thought I heard Mayor Gimenez say positivity rate today on the dashboard in Miami-Dade was 6.6%, which I think leads me to say, are you rushing this?
Well, we actually have it at 4.87. So I think if you take all the retests, you'll have a little bit higher because people retest, so that they're not doing it as much. So anyone who's kind of new that hasn't already tested positive, we have it at 4.87. I'd also say we've been doing in Miami-Dade now for probably over a month the point of care tests. So people that are symptomatic are going to places like Marlins Stadium, Hard Rock, out to Miami Beach, and that positivity has been under 10% for over a month. And we typically will get days where it's between 4 and 6. So those are symptomatic people with point-of-care testing. Some of these other tests, sometimes they get dated. We've seen data dumps. We've seen all these other things. So no, I don't think so at all. And I think we had the same kind of questions asked with our other counties. Because, you had some counties didn't have a severe outbreak as Miami, but some of them were at 7.5%. They were on the way down. And I think what we've seen is with schools being open in person, the prevalence has continued to go down in all those places. We have not seen schools spark community outbreaks. We have seen the ED visits, the criteria that we're looking at here, that's happening statewide in all sectors of the state. And so I think it's important. And you also have to look at it as, our approach in Florida is, we have a health crisis with the virus, but we also have health crisis with a lot of other things that have gotten worse since this crisis with the virus began. Mental health, drug abuse, missed cancer screenings, missed medical, heart, stroke, people that didn't go in. That's very important. And then we also are saying we're going to do best over the long term on this if we have a healthy, strong society. That means having a functioning economy. That means having a lot of things. But a school system is so important to so many communities that the costs of not having that are just so dramatic. And I think we're seeing that as we've had other school districts go in. And so I said it's more of a challenge when you have a big urban district, but I think that because Miami-Dade has been such a leader in on all facets of education, they're going to be able to get it done and get it done right. Yes, sir.
There's an obituary today in the Miami Herald that the family member somewhat lays the blame of the death of their loved one on stated policies and the president's policies. What are your thoughts about the people out there who have lost folks, who are kind of going to the grave with grudges on the coronavirus?
Oh, well, look, I think we've seen, some heartbreaking stories. I mean, when you have folks who get sick and end up not only sick and hospitalized, but of course, when they pass away, it's even more tragic. And then doubling that, a lot of these deaths occurred in isolation because of worrying about having the virus spread in a hospital, nursing home. And so, this has been really, really difficult. What I did was, we focused a lot very early on protecting the most vulnerable in long-term care. We had to do some tough policies. Some of them I think were common sense. Don't let hospitals send sick nursing home patients back in there because they can affect other folks, and you see how that's worked out when that's been tried. So we protected there, but we banned visitation because we were concerned about people bringing the virus in. But I can tell you, it's fine to do that for 2 weeks, a month, but as we started to get on, that brought a lot of pain and anguish to a lot of families. I mean, you have people, nothing to do with COVID, who pass away in a nursing home and never got to say goodbye to their loved ones. And so as we started to see that, I had to take a step back and say, okay, this is a legitimate human toll. This is loneliness, despair, and separating people from their families. We cannot say no to visitation for the loved ones. And you got to do it right. You got to be careful. So we created the task force. We did it. And now people are very, very happy. But I mean, I think seeing some of those folks who were separated, it's really, really tough because that is a result of us trying to take protective measures. But at the same time, I talk to family members who say, my mother's 95 years old and she's telling me I don't want to get COVID, but I want to see my family. It's important to me. And so we had to take action. So I think people have been through a lot, and I know it hasn't been easy for many people. Yes, sir.
President Trump told Bob Woodward in early February that he understood that the coronavirus was more contagious and more deadly than he was telling the public. What did he tell you, and when did he tell you?
He didn't really say anything. I mean, we started monitoring this in January. I called for the president to do the China travel ban before he did it. I think it was the right thing to do. If you remember that time in February when he did the travel ban, he was criticized for doing that. A lot of people said, particularly a lot of the folks on cable that worry about common colds, worry about the flu, that this was an overreaction. Then obviously there was a change. I think there's been a lot of you've had some say this, that. Remember, the World Health Organization in January said it wasn't contagious, wasn't transmissible person to person. They tweeted that out the third week of January. You had other folks all through February in high positions in the U.S. government saying this is not anything that you should worry about. This is not something that's likely to affect the United States. You had people even the second week of March saying, go on cruises, just make sure that you sneeze into your elbow. So I think you've had a lot of people say a lot of different things, but I really think there was a legitimate uncertainty. What we tried to do in Florida is, we were testing everyone coming back. We had very limited tests because the CDC didn't handle that the way we wanted. But they're coming back from China. We were testing, trying to find, and I think we thought that it was not that widespread. I think in hindsight, this was something that was much more widespread in the United States in February than we had thought, and obviously it continued to grow from there. And but I remember back those days, there was just a lot that we didn't know. But no one ever told me, hey, we're going to say this, but really this is the case. We always thought that it was something that was very significant for people who were elderly and people who had significant underlying conditions. I think that was pretty clear as we got into February. Wasn't as sure about everyone else, but I think the data has shown, that it's much less risk for people who are younger and healthy. So, but I think that was just people were trying to do the best things that they can do. But when he took action, I remember people were criticizing. They were saying, don't do it. They were saying it was racist to shut down travel from China, which was absurd. Of course you do it. I supported the European restrictions, but in hindsight, that didn't happen soon enough. It had already come in to the East Coast from Europe. So you do what you got to do on all those things. But I mean, we know so much more now than we did back then. That sometimes people act like hindsight. I mean, there was really a lot of uncertainty in those early days.
You talked about positivity rates being down, but go back to Memorial Day. The rates were much lower than they are now. That led to a loosening, and 6 weeks later, 200 Floridians were dying a day. What's going to make it different this time?
Well, notice, we didn't shut down the state over the summer. People were saying to do that. I think an evidence-based approach would say that hasn't proven to be terribly effective. Now, we had not had a lot of prevalence in Florida in March, April, May. That's just the reality. What we had in South Florida was a spillover from the Northeast. But if you look across the Sun Belt, there just wasn't as much prevalence. It was a Northeast outbreak. Some spilled to Florida and other parts of the country. Like New Orleans had the Mardi Gras. That was other people bringing it in. So then we had a widespread from coast to coast across the South increase in prevalence. Didn't close down, trusted people to make good decisions, and that curve has now shifted. But I don't think you can say that somehow we're in the same spot. We've basically had the same general policy in terms of protecting the elderly, supporting the hospitals, but keeping society going. Remember, Disney reopened at the peak of our infections, and what happened from there? It went down from that second week of July all the way until the present. So we're ready for what happens. Look, I hope we don't have the same type of wave that the Sun Belt had, but we're prepared. I mean, we have the personnel when they needed it in Miami-Dade. We had healthcare personnel. When they needed medication, we had the medication. Obviously, we have a lot of testing capacity. That's without question. We had over 20 COVID-only nursing facilities that had been set up. Now, those census on those are very low, so we're likely going to kind of collapse some of those and streamline that. But that is all things that could happen that we can do going forward. And so that was, I think people should just think back to the 15 days to slow the spread. What was the stated objective of that? Was to slow the spread so that our hospital systems didn't get overwhelmed. No one thought that you could just somehow hide in a hole for 2 weeks and then the virus would disappear like we would do with a hurricane, wait till it passes and then come out. So we knew it was going to be something we were going to have to deal with. We were anticipating there to be more of a surge in the fall vis-a-vis summer, because that's just what people were saying. They thought that the virus would be more, more lively in the fall because people, their behavior. We didn't know, but we were ready for whatever. So you'll be ready going forward. But I think that you have to tend to society's needs. You have to put people back to work. You have to educate our kids. And I think that that's going to be the approach that we continue to take. Yes, ma'am? Every single day when you get the daily report, excuse me, when you get the daily report, you can see by age how every new positive case is broken out. So guess what? If you have the 17 to 24 category that they have in Leon County or Alachua, and you see a lot of cases, well, guess what? Those are university students at FSU or UF. If you see them in lower age groups than that, then you know that's that. Then it's going to be a K-12. But here's what I would say. What I would like them to they are looking at it. We've had very few cases compared to the number of students that have been in session. We've had about 1.2 million students that are in person learning. Obviously, when Miami comes, that's going to be a lot more. The number of positive tests that you've had over that time is such a minute part of that. That the school districts are handling it, as they go. And so it's not like if a test is reported to the state that the state necessarily knows which school that came from. That's not the way it's going. But I can tell you this, the Commissioner of Education, I asked him to get as much data as we can. So he's gone to the Surgeon General. They've looked at it. Hopefully we'll be able to have something that they can produce in a digestible format. But the fact is, the secondary transmission in our schools, and not just Florida, this is everywhere, is incredibly low. In fact, there just hasn't been as much secondary transmission. You'll have situations where someone will be symptomatic on like a bus, and then they'll quarantine all the kids on the bus. I don't think you need to do that, but when they're doing that, very few of those kids have tested positive who've been in these types of these isolations when they don't have symptoms. And so that's just something that I think has been the experience, not just throughout the United States, but I think that's been the experience throughout the world. And so that is why when you view something like this, it's different than what our instincts would tell us with an influenza, where the kids have the germs and they're passing it around. The fact is, kids being index cases and fueling secondary transmission, the data just doesn't support it as it currently stands. Yes, ma'am. Oh, look, I mean, we're in a difficult situation. There's going to be bumps in the road, and you just deal with it. And so I know it was frustrating, but you know what? They're working night and day to get it right. They're working to open the schools for in-person. And so I can tell you that whenever there's been an issue that needs to be addressed, the Commissioner of Education doesn't need to call the superintendent. Superintendent's already dealing with it. We stand by ready to help if there is more federal assistance coming down the pike. We obviously know that the schools would be a place where we may be able to make an impact, and so we stand ready to help with that as well. Wait, someone who hasn't asked. Go ahead. Go ahead. Spanish? Yeah, go ahead. Yep.
Como hablamos ayer, nosotros tenemos un plan de reapertura de escuelas que es bien informado por expertos de salud pública y de medicina aquí en nuestra comunidad. Y ellos han declarado un plan aprobado por nuestra Junta Escolar que declara varios datos científicos y criterios necesarios para la reapertura de escuelas. Una reducción de la positividad, la tasa de positividad, una reducción de hospitalización aquí en nuestra comunidad, también un mejor proceso de tests y los resultados más rápidos. Y claro, en este momento, con el anuncio que el lunes nuestro condado va a pasar a la fase 2, es sumamente importante porque todos los datos científicos necesarios para la reapertura de escuelas están mejorando. Pero era importante también alcanzar un punto de fase 2 para nuestro condado. Nos da a nosotros la oportunidad de tener una conversación muy franca, honesta, con nuestros asesores de salud pública. Lo vamos a hacer la semana que viene. Vamos a obtener las recomendaciones de ellos. También vamos a tener una reunión especial de la Junta Escolar para discutir los planes de reapertura. Vamos a continuar a seguir la información médica necesaria para proteger a nuestros niños y a nuestros empleados.
Great. Well, I'm going to get going, but I just want to commend both the superintendent and the mayor. I know that they care very deeply about the families and about the kids, and you just see the results with the AP today. That's changing kids' lives to be able to have that type of opportunity here, and we're also happy to see the U back in action, and we really appreciate that working out, and we're glad that they were able to notch a victory. So good on you guys. Thanks.